Hello, my friends. I want to talk about some points which they are so important in the medical sphere, especially for students which they are finishing soon and they are going to medical sphere profession. First of all, you have to reduce the complications of the disease or any kind of developing of the disease. That's so important in the medicine. Some strange stuff's happening sometimes in Russia, in emergency care personals. When you are calling emergency care, because I'm working as a GP, so they're coming and they're laughing at your diagnosis sometimes. But when you're hospitalizing the patient, forcing them to, how to say, take the patient to the emergency care department, and you call the patient later, after few days, you find out that this person were in a intense emergency care department. He was under the oxygen. He had some really bad situation. You saved the life of the patient. So don't care who is saying what. Just care about the health of the patient. It's so important. If you feel dangerous for the patient in a really bad health, just call the emergency care and just let them to take the patient to the hospital. Especially the doctor which they are working as a GP, because you are just only depending on the physical examinations and you can't find a lot about the how to say acute phase of that disease at the moment. You have just only some sign and symptoms. If you don't care about the sign and symptoms, you don't make such probability, which is saying like soon the patient will be in the trouble, or he will have complications soon and you have to save him. uh, you will not do anything, and after a few hours the patient may will end up with a really bad complication or will die. So that's why don't care about others opinion when you are thinking the patient really having uh, acute phase. And even sometimes when the patient having like cardiovascular diseases and feeling themselves bad, and you are doing ECG but not finding anything, for example, it can be the non-stable angina, and it's in a primary stage, and you will not find anything in the ECG. So your function is to not allow the patient to have myocardial infarction and to reduce the complication before. If you will say, oh, the patient will not have any myocardial infarction, just I'm prescribing some drugs and I will let him go home, or at home I will leave him. Definitely you are wrong, and you have to uh, examine the patient completely, not only physical examination, but the instrumental also. So the function of the emergency care is to come and take the patient, and your function is to save, and you have to think about reducing the complication of the patient at the moment. That's why uh, do your physical examination and make your probability and go for the diagnosis. For example, like 2 days ago, I hospitalized a patient. He had really hard extrasystole and really high tachycardia. He was like feeling himself bad, The main sign and symptom was he was saying I'm using nitroglycerin and it's not using already not useful already for 3 days, and I have pain in the chest. So it's just how to say compressive pain. And I asked him, "Did you have any dyspnea?" He is saying, "I had no any dyspnea up to these 3 days." So we did the ECG, and in the ECG, just we found tachycardia and some arrhythmia, and nothing more like extrasystolic. But the patient was, how to say, sweating, and he was saying, "My head is going around, dizziness I have." Um, I consulted with some other doctors, and they said it may be just because of the tachycardia, nothing more, fainting and dizziness. But I was thinking something is happening. These people are not listening to the patient. That's saying the nitroglycerin is not helping now, and some of them they're saying just it is neuralgia, nothing more. And the emergency personnel, the doctor which is coming to the patient, when I called the emergency care, saying, "Doctor, why you are hospitalizing this patient is just, how to say, very not comfortable for you, and shaming you that you are hospitalizing such like patient." I was thinking, what the hell? I'm trying to save the person, and she's saying me such bad thing. Okay, I said I don't care about your opinion. I'm just hospitalizing the patient, and I feel she's in a trouble, so I hospitalized it. After 2 days, like it was yesterday, I think. So I called the number which was in the anamnesis, and the woman answered the phone call, and she said he's in the emergency care department and in the intensive care, and he had non-stable angina, and if I was not saving him, saving his life, soon he had like myocardial infarction, and it could be end up with a really bad situation. So you see, if you don't believe in yourself and you listen to others, you will be in the trouble. Patient will be in the trouble, and the situation not will not be really good for both. So uh, believe in yourself, and first of all think about the health of the patient. Your function is to save the patient, not to how to say, to think that you are really smart and you don't do anything. You just prescribe some drugs and send in the patient to home. Because a lot of patients are, when they are coming to me complaining of that the doctors are not listening to us, and that's a huge problem with when you are not listening to your patient. And the primary care for the patient, the primary line, is to listen to your function is to listen to the patient and what he's saying, to reduce the complication, to improve his life, to prevent the progression of the patient's disease. So without taking a good anamnesis, without listening to the patient, you will not save anyone. You are just doing bad. You are just worsening the situation. So I'm asking you to listen to the patient first of all, and use your brain, and use your how to say, humanistic instinct. In order to save, your function is to save the patient, but not to harm the patient. That's why do maximally, not do minimally for your comfort. Thank you for listening.